Depression is a common mental health condition that affects millions of people worldwide. It's characterized by feelings of sadness, hopelessness, and loss of interest in things that were once enjoyable. Depression can also cause physical symptoms like fatigue, changes in appetite, and difficulty sleeping. While everyone experiences sadness or grief at some point in their lives, depression is a persistent and often debilitating condition that requires professional treatment. Fortunately, there are many effective treatment options available, including medication, therapy, and lifestyle changes. In this video, we'll explore the top 10 drugs for depression in the US. Let's get started. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read on this blog post. Prozac. Prozac is one of the most well-known and widely used antidepressants in the world. It was first approved by the FDA in 1987 and has since helped millions of people manage their depression and anxiety symptoms. Prozac is a selective serotonin reuptake inhibitor, or SSRI, which means it works by increasing the levels of serotonin in the brain. It's often prescribed for people with major depressive disorder, obsessive-compulsive disorder, and bulimia nervosa. Prozac's development and rise to popularity is an interesting story. In 1970s, a group of scientists at the pharmaceutical company Eli Lilly were working on a new drug to treat high blood pressure. While the drug was ultimately unsuccessful in treating hypertension, it was found to have an unexpected side effect. It boosted the levels of serotonin in the brain. Zoloft. Zoloft is another popular SSRI that's often prescribed for depression, as well as anxiety disorders and post-traumatic stress disorder. It was first approved by the FDA in 1991 and has since become one of the most commonly prescribed antidepressants in the US. Zoloft works by increasing the levels of serotonin in the brain and is often used to treat symptoms like fatigue, irritability, and difficulty concentrating. Lexapro. Lexapro is a newer SSRI that was first approved by the FDA in 2002. It's often prescribed for people with major depressive disorder, generalized anxiety disorder, and social anxiety disorder. Like other SSRIs, Lexapro works by increasing the levels of serotonin in the brain, but it's thought to be particularly effective for people with severe depression. Some people also report fewer side effects with Lexapro compared to other antidepressants. Effexor. Effexor is a serotonin norepinephrine reuptake inhibitor, or SNRI, that was first approved by the FDA in 1993. It's often prescribed for people with major depressive disorders, generalized anxiety disorder, and panic disorder. Unlike SSRIs, which only affect serotonin levels, SNRIs like Effexor also increase the levels of norepinephrine in the brain. This can help improve mood, increase energy levels, and reduce anxiety. When Effexor was first approved by the FDA in 1993, it was considered a significant breakthrough in the treatment of depression and anxiety. Unlike SSRIs, which only affect serotonin levels, Effexor's dual action as an SNRI means it can be particularly effective for people who experience both emotional and physical symptoms of depression and anxiety. Wellbutrin. Wellbutrin is an atypical antidepressant that's often prescribed for people with major depressive disorder and seasonal affective disorder. It was first approved by the FDA in 1985 and is thought to work by increasing the levels of dopamine and norepinephrine in the brain. Wellbutrin is also sometimes used as an adjunct treatment for people who don't respond well to SSRIs. Celexa. Celexa is another popular SSRI that's often prescribed for depression, anxiety, and panic disorder. It was first approved by the FDA in 1998 and works by increasing the levels of serotonin in the brain. Like other SSRIs, Celexa can take several weeks to start working, but it's generally considered safe and well tolerated by most people. Paxil. Paxil is an SSRI that's often prescribed for people with major depressive disorder, social anxiety disorder, and obsessive-compulsive disorder. It was first approved by the FDA in 1992 and works by increasing the levels of serotonin in the brain. Some people report fewer side effects with Paxil compared to other SSRIs, but it can also be more difficult to taper off of. Cymbalta. Cymbalta is an SNRI that's often prescribed for people with major depressive disorder, fibromyalgia, and chronic pain. It was first approved by the FDA in 2004 and works by increasing the levels of both serotonin and norepinephrine in the brain. Cymbalta is thought to be particularly effective for people with chronic pain and depression, as it can help reduce both symptoms simultaneously. Over the years, Cymbalta has become a popular choice for people with a range of conditions, including major depressive disorder, generalized anxiety disorder, and diabetic neuropathy. Its dual action as an SNRI makes it particularly effective for people who experience both emotional and physical symptoms of depression. And it has been shown to improve overall quality of life in many patients. Despite its effectiveness, it's important to note that Cymbalta, like all antidepressants, can have potential side effects, and it should only be taken under the guidance of a healthcare professional. Trazodone. Trazodone is a unique antidepressant that's often prescribed for people with major depressive disorder, anxiety, and insomnia. It was first approved by the FDA in 1981 and is thought to work by increasing the levels of serotonin in the brain, as well as blocking certain receptors that can cause sedation. While trazodone is effective at treating depression and anxiety, it's also commonly used as a sleep aid due to its sedative properties. Remeron. Remeron is an atypical antidepressant that's often prescribed for people with major depressive disorder, anxiety, and sleep disorders. It was first approved by the FDA in 1996 and works by increasing the levels of both serotonin and norepinephrine in the brain. Remeron is also thought to have sedative properties, which can make it particularly effective for people with insomnia or other sleep disorders. The development of Remeron, also known as mirtazapine, is an interesting one. In the 1980s, a researcher at the Dutch pharmaceutical company Organon were researching for a new antidepressant that would be effective in treating a wide range of symptoms. They were particularly interested in finding a drug that could help with both depression and anxiety, as these two conditions often occur together. When mirtazapine was first approved by the FDA in 1996, it was considered a breakthrough in the treatment of depression. Unlike other antidepressants, which can take weeks or even months to start working, mirtazapine was found to have a rapid onset of action, with many patients experiencing improvement in their symptoms within just a few days of starting the medication. While there are many drugs available to treat depression, it's important to remember that everyone's experience with depression is different. Some people may respond better to SSRIs, while others may do better with SNRIs or atypical antidepressants. It's also important to work closely with a healthcare professional to find the right medication and dosage for you, as well as to monitor for any potential side effects. In addition to medication, it's also important to incorporate other treatment options into your depression management plan. This can include therapy, exercise, and self-care techniques like mindfulness and meditation. By taking a comprehensive approach to depression management, you can improve your symptoms and overall quality of life. And if you're new here, hello and welcome to Medication Updates Quick Facts. Our channel's focus on health and wellness topics is driven by the increased awareness and importance of maintaining good health in our fast-paced and often stressful lives. There has been a surge in interest in health and wellness topics in recent years, as people have become more health conscious and proactive in managing their health. If this is something you're into, consider hitting the subscribe button and ring the bell icon so you can be updated on our next upload. Thank you for watching.